This is Brent again with Arosty, and this is part 2 of my series talking about low back pain. And so essentially, we're going to be talking about generalized low back pain. So obviously, if your symptoms are getting worse or seem more severe, seek the advice of a professional. But for just kind of generalized low back pain, obviously the pain is somewhere in this region. And the way we're going to be addressing this area is we want to reduce the tightness here, but also the muscles of the anterior thigh play a vital role in the low back pain. And so I want to reference back to my video on the quadriceps and hip flexors. And I'd highly recommend watching those videos and also following those methods, as they will really help in addressing the pain that's in your low back as well. The next goal would be getting more activation in through the glutes, as if we can get more activation in these muscles, then we can reduce the stress in the low back. So, a couple of methods I'm going to demonstrate. I'm going to be using a ball for this method, and essentially I'm going to be using this ball to reduce the tightness in the low back and the glute muscles. So this can be done with a softball, baseball, I have a lacrosse ball, tennis ball, and essentially by lying down on my back with my legs up on a chair, I can get these muscles to relax more, which will allow me to get deeper in with the ball. And so I'm using this in through the glutes, and when I find a tender spot, I'm going to breathe through it, hang out here for a while, and then move to a new area. You want to make sure that you cover the whole area on both sides, and the same thing in the low back. So I'm in the fleshy, meaty part of the low back. I'm not going to be right on the spine or any bones. If you feel numbness or tingling while doing this, then simply move off of that area. Another tool can be a foam roller, where you're addressing those same areas, but with the foam roller. Okay. And then a pole such as a PVC pipe or a broomstick can work really well in practicing proper technique with like a hip hinge. And so I put the pole against my head, my back, and the glute area. And then from here, I'm just going to simply hinge back, hinge forward, get a nice strong contraction of the glute muscles. And this should really help practice the technique if I'm doing like a kettlebell swing or a deadlift or other types of lift that involve hinging. Okay, so in summary, this is to address kind of more generalized low back. And if you have more serious problems or symptoms that are getting worse, highly recommend seeking the advice of a professional.